Welcome. My name is Ian Thompson. I'm the Manager of Partners in Culturally Appropriate Care, Western Australia, part of the National PICAC Alliance. And PICAC's job is to support aged care providers and staff working for aged care providers to provide the best quality care that they can for older Australians from culturally and linguistically diverse backgrounds. Today, this broadcast is from Whadjuk Noongar land, and we'd like to acknowledge elders past, present and emerging. With me today, I have Ruth Way, who's Senior Lecturer, School of Nursing, Specialist in Palliative Care, End-of-Life Care and Death Education at Murdoch University. Welcome, Ruth. And then I have Sabina Lund, who has a background as a counselling psychologist, and Sabina delivers community workshops for palliative care in Western Australia. Today's session is half an hour. We've got a topic that is rich and challenging, and we hope that in the presentation that you'll take away from this something important learnings that you'll be able to apply for the people that you care for. I am a reluctant expert in palliative care, having had my father and my father-in-law and a close personal friend both go through palliative care experience in the very recent past. And as a result of that, I am super excited to be here today because it's very important for everyone to have a really good understanding, because my experience certainly is a very positive one for the support and assistance that you get going through a difficult time for families. And so without any further ado, I would like to ask the first question to you, Ruth. Why is palliative care important for aged care providers?
Good morning, everyone, and thank you to have me here today. And before I answer this question, I would explain what palliative care is and the palliative care approach. So palliative care is a person and family-centered treatment care support for people with life-limiting illness. So, and a palliative care approach recognizes death is inevitable and focuses on the care rather than the cure. So a palliative care approach addressed a person's psychological, social, spiritual, emotional, and cultural needs and aims to improve a personal level of comfort and function, and to offer proper treatment for any distressing symptoms. As we all know, Australian population is aging, and about 4.2 million Australians, which is about 16% of the entire Australian population, are aged 65 and over. And 80% of them have at least one chronic disease, with 1/3 nearly have more than two. So when it comes to the aged care facilities, we can imagine that it's most likely they have multiple disease conditions. Also in Australia, 1/3 Australians die in residential aged care facility. So we can say it is important. And also palliative care aims to improve the quality of life. So for the person who are facing life-limiting illness, and support their families as well. So they not only focus on the symptoms management and pain control, they also address their social needs, spiritual needs, and emotional needs at the end of their life. So by providing palliative care, the aged care providers can ensure their life at the end of the journey, they're comfortable, with dignity, and with pain controlled. And also palliative care takes a holistic approach, as we mentioned before, not only physical management, but also psychosocial, cultural, social, and and the spiritual needs. So which is particularly important in aged care facilities or settings, because in that situation, people might have more chronic disease, more complex care needs, and they require individual tailored care plan. Except that palliative care is a person and family care model. So they not only provide care to the people facing the very distressing situation and help them to, to actively live in their life until the last minute. Also to offer the support to their families. So on the other side, we can say this approach could reduce healthcare cost by minimizing hospitalization and emergency visits and unnecessary intensive care treatments.
Thank you.
Thank you.
Thank you, Ruth. Quite a lot for us to consider. So I thought I'd want to engage you fairly quickly, Sabina. And my question to you is, what do you think prevents good quality palliative care and advanced care planning for aged care providers?
Thanks very much for the question, Ian, and again, thanks for the opportunity to be here. Quality palliative care and advanced care planning is certainly important to me in my work role and also in my personal and family life. So my mum, who's from Germany, died with advanced dementia in aged care. And we were very fortunate that we had conversations with her while we still could, and we did have her wishes in writing. So when it came to making difficult decisions, we knew we were enacting her wishes rather than having to have on our shoulders the weight of those decisions. So to start off with, I want to be clear about what advanced care planning is. Advanced care planning is person-centered care, and it empowers people to have a say in their future healthcare decisions, even if they lose capacity to make or to communicate their wishes. Advanced care planning involves thinking and talking about what we want in the future, in the areas of health and lifestyle and finances. It's important also to put what we want in writing and to share these documents. So completing an enduring power of guardianship ensures that we have a person or people who can speak for us when we no longer have a voice. And then there's a range of forms, advanced care planning forms that can be used, including the Advanced Health Directive and residential goals of care. So that's what advanced care planning is. So then back to your question, what prevents quality palliative care and advanced care planning in aged care? One of the key barriers is not taking into account cultural and linguistic diversity. We need all clients to understand what's going on and what their care choices are and how they can have a voice if they become less well and are no longer able to speak for themselves. We all need to feel safe, and that includes feeling culturally safe and culturally respected. So quality palliative care and advanced care planning happens when organisations acknowledge and respect cultural and linguistic diversity and support each client as an individual, offering that person-centred care that Ruth was talking about. Organisations need to have effective palliative care and advanced care planning policies and procedures in place. They need to be able to allocate the time and the resources to train staff in those areas, and to provide staffing levels that allow enough time for respectful conversations around advanced care planning, as well as delivering holistic palliative care. Being clear about whether the person has capacity for advanced care planning, and is it better to engage directly with that person and or with the family, and to support staff to gain the skills and the confidence to have these challenging conversations. At the same time, we need to acknowledge that even with timely and respectful invitations, sometimes the person or the family may not be willing or able to talk about their wishes or their goals of care when the topic is raised. And thankfully, we do have both palliative care and advanced care planning resources in many community languages, and we'll be sending out a resource sheet following this webinar with links to these called resources.
Yeah, thank you, Sabina. So, Sabina, at a practical level, since we're addressing aged care providers and people working for aged care providers, what do you think are the basics for setting up good advanced care planning, and what are the elements that you probably really need to provide extra focus on for older Australians from culturally and linguistically diverse backgrounds?
Thanks, Ian. So I'd like to highlight three things in terms of setting up good advanced care planning. The first of those is creating opportunity through leadership and governance, policy and procedures. The second is commitment and involvement of all staff through education and training to be able to support clients to complete advanced care planning. Then the third is listening to each person as an individual. When working with older Australians from culturally and linguistically diverse backgrounds, it's important to have an interpreter available if needed, to use translated resources when available, and to take time to make sure the client and the family feel heard and are partners in the process. So that gives a respectful and a two-way approach that helps ensure cultural safety. So one example, best practice example within community aged care is when those policy and procedures, staff training and alerts in the system result in care coordinators asking at intake and at each service review whether the client has an advanced care plan in place, and if not, has the time and the skills to help them complete this document. That way, coordinators are offering person-centred care and taking cultural and linguistic diversity into account. In a residential aged care setting, something as simple as celebrating Harmony Day with food and images from clients' countries of origin can help residents feel respected and included.
Thank you very much, Viva. Now, turning my next question to you, Ruth. You've got a lot of experience working with culturally and linguistically diverse communities. So from your perspective, why does culture need to be considered in palliative care and advanced care planning at all?
Good question. And understanding and respecting a people's culture is essential, in providing person and family-centered care. And also in Australia, we say Australia, I believe, is the most successful multicultural society with more than 300, entities in the country and with multitude of cultures, beliefs, traditions, and more than 400 languages used. In Australia, more than half population were born in overseas, or at least one parent born overseas. So we can say it's very diverse. So that's quite important. And also the people, when they come to Australia, and the people that bring their cultures, their traditions, and these cultures, traditions, the values, influence the people's attitudes towards the health, illness, death, and the dying, which also influence the people's attitudes towards one another to accept, access palliative care, and approach, advanced care planning discussion. So in some cultures, death, we know that is considered taboo or feared. People try to avoid to discuss it. And some people interpret, palliative care as giving up. Just a few years ago, 2020, US conducted a national survey, and the finding noticed that 44% thinks palliative care as death, and 38% equals palliative care to hospice, and 60% thought that it's palliative care is giving up. So we can say this is kind of this common misconceptions in the people, and these misconceptions influence the people to open themselves and to access and accept palliative care, end-of-life care, even advanced care planning as well. And also in Australia, we all say we respect individual decisions, and particularly the healthcare decision. However, in some cultures, families plays essential and influential roles in decision making. So the treatment or care decision is based on the family decision or based on the interest of the family rather than focus on the person's individual's preference. So for example, one of my brother-in-laws diagnosed with lung cancer, and the daughter just said it's 1 year. He left. And then the family had family meeting and make a decision to say, well, we are not going to tell him. So he didn't know anything until the last month, he passed away. I knew I should tell him, but I couldn't. That is the culture. Can you see here? And also the the family, you could say, always make decisions whether or not to tell the person the bad news, and which is similar in the healthcare providers in some cultures. Then doctors would say, okay, could you ask your families come here? I have a meeting with them. Instead of say, I'm coming to tell you what's your diagnosis. So that's a lot of things. And the families, the family members, they are all prefer this way. They don't want the doctors to tell them straight away. They think they could provide them hope. It helps them to survive better. So in that case, say, we can say the family has been involved very deeply in the healthcare decision making. So we can see that by providing, private care to the patients or to the, peoples, understand the cultural background is quite essential. Thank you.
Thanks, Ruth. It's impossible to listen to what you're saying without, reflecting on my recent experiences. And I know that the palliative care journey for my family really took all of us with it. And a really important part of it for us, we're from a Scandinavian background, is explaining to my 2-year-old and 4-year-old granddaughter that Oliver, the beloved Oliver, is dying, and the journey itself and the palliative care, the experts that shared that journey with us, I mean, we've explained it in Norse legends, that he's up with Thor, and every time the lightning strikes, they'll say now, oh, Oliver's up with Thor. Yeah. And that's a nice way for the family in a cultural sense to, explain it away, something that otherwise is quite different. And I suppose that's the difference in culture, isn't it? In our culture, that was a way to proceed. I suppose I've got a tough question for you, Ruth. Okay. I love giving you tough questions, Ruth. So this one, so I want to talk about pitfalls. So what you actually avoid when we're talking about that culture plays such an important role and it's so diverse. What are the pitfalls of dealing with palliative care, advanced care planning when you've got that cultural lens?
It is a tough question. Thank you. I think the first thing you should avoid ignoring their, cultural norms and the traditions and some health practice, traditional practice as well. So each culture have their norms, beliefs regarding the health and illness, death, and the dying. So ignoring or dismissing these, cultures might hinder effective communication with them, maybe also stop them to access, and palliative care as well. And for example, some cultures, the people, they prefer to still have the health practice, the traditional one, and the tribal herbs, the acupunctures, which is, included in their, last, journey, and which we don't know whether or not it's effective, but that's their beliefs. So, and also even people from, same culture or the same country, same background, but we can't assume they have same attitudes, same beliefs and the norms regarding that. For example, my parents and I, we are all from the same culture, yes, right? And we all grew in the same environment, but my parents couldn't accept that. For years, I tried very hard to say that's something important, but no, it's no. So so we try to say, and also in some cultures, some words are very sensitive. So how to select the proper words to initiate, to discuss with them, which is also important for healthcare providers. So we can't just straight away to say death or dying. It's not the words we normally say. You have to go a different way to say has gone, or he passed away, or something is not, he's not here anymore. What kind of, the words must be very careful. And last but not at the least, I want to address the family involvement, particularly in advanced care planning, because I have met so many cases, their families, they are not supportive for the old people or their parents to sign or to go through an ACP process. So I think that's what I would say to give. Anytime if you want to discuss about ACP or palliative care, assess their cultural background, their understanding, and their experience related to this is quite essential.
Yeah, thank you.
Thank you.
Thank you. just listening to all of those potential pitfalls and being able to take important learnings out of that and apply them in our practice, I'm thinking that for me personally, it's always important to maybe share a couple of stories, because I always tend to remember a story more than I will remember facts. So if you don't mind, is it okay for the two of you to perhaps share a story from your experiences around palliative care? And who would like to go first?
I start first.
Okay, Ruth.
I start first. Okay. I just share one of my friends' experience. So my friends migrated to Australia with her mother as well, and her mother diagnosed with liver cancer years ago. And then after years of treatment, and she came to the last point, and one day, and the doctor just said, that is, no more we could do. It's the time we can introduce or refer you to palliative care. But for the so many years treatment, the daughter is a healthcare provider. She totally understands palliative care, everything, medical terminologies as well. She acted as the translator or translator for the mom for many years. So when the doctor came to her and her mother and said, "Could you just tell your mom, say it's about 6 to 1 year she has left, and there's no more treatment here, but we will refer you to palliative care, and their team will look after you." And she explained to the mom. However, when the mom went back, and then she was still under the pain, she was still, something she wasn't unsure. She consistently required to see the doctor. And the daughter had no choice and made another appointment with the doctor. So between the conversation, the doctor and the mom, the doctor realized that something wrong. And he realized that the mom didn't know the situation. There's no more treatment, active treatment. It's just for the comforting care.
Yeah.
And then he asked the daughter, say, "Have you explained to your mom? Your mom seems she doesn't know." And the daughter just said, "How could I explain to mom? Mom, you only have 6 to 1 year left." So that is the very difficult, situation for the daughter, and which is also reflect to myself as well. How could I explain it to my parents, say, "Mom, you only have half a year left"? Thank you.
Thanks. Well, Sabina.
Thank you. Thank you for sharing that story, Ruth. And I guess this story has a similar theme, looking at the role of culture and the role of individual preferences. So here we had a South American couple, and they were being assessed for aged care services at the home. And in that culture, the culture was generally that the husband made decisions for the family, and generally that worked for the couple. However, the care coordinator did actually make the time to meet with the wife on her own, and the wife then was clearly indicating that she wanted to make her own advanced care plan, write her own advanced health directive herself without input from her husband. And so that example shows us that it's doing the both. It's looking at culture and taking that into account, but then also in terms of providing person-centered care, listening to each person as an individual and not making assumptions on the basis of that culture.
Thanks very much. Thank you very much, Sabina. Thank you very much, Ruth.